Hi, class. I hope everyone's doing well. I know this is a very difficult time for everybody. Uh, I know your emotions are probably ranging from bored to overwhelmed to any combination of all this, missing our uh, normal routine that we've kind of gotten used to over the start of pharmacy school. I aggregated some of the responses to the social determinants of health quiz, and everyone did a great job. A lot of insightful, thoughtful responses. I appreciated that everyone took this seriously and went above and beyond, uh, and really provided some interesting responses. So I'm glad you all had a chance to read those articles. Some of you read even more articles in addition, and did some thinking. First thing I wanted to bring up, I regraded an item on the pre-class quiz. I think I had intended for this to be a accept item, like choose which of these doesn't fit. Um, so I've accepted all of these answers: social determinants, physical determinants, neighborhood and built environment. All of those are okay. Uh, Terms that refer to the availability of resources to meet daily needs. So we can think about, uh, you know, kind of the social aspect of having a safe place to live, but also the physical aspect of having a house, um, having somewhere, a physical structure, but also a psychological safety, and then kind of the neighborhood and built environment that may relate to having, can you get fresh fruits and vegetables as a resource? So any of those are okay options. Now getting to your uh, assignment responses. So I had asked you to link social determinants of health that you had picked up from the articles or from things that you had heard maybe on the TV, radio, whatever media you're consuming. Um, and how those relate to COVID-19. And so there's a lot of kind of interplay here between cause and effect, right? So COVID-19 causes people to have economic instability, right? Especially people living paycheck to paycheck. Uh, and then that is going to have multiple effects related to health. Um, we know that stress is bad for your health, right? You could have a heart attack, right? Because you're so stressed out, or you could go hungry. Um, all the total gambit of different effects related to health that you could have. Housing instability, homeless, right? Maybe you're already homeless, and now there's COVID-19, and so we know it's difficult to do social distancing, difficult to receive care, right? Who think of all the factors, the social factors that go into someone having a primary care physician, or even having the health literacy to know, how do I get care? Is this even a symptom that's worth paying attention to? A lot of you mentioned rural aspects of the kind of the social determinants of health, right? So maybe you live in a community that doesn't have a lot of providers or other resources. You know, maybe the pharmacist in town is one of the only providers of care. Employment, essential workers. We know that they're getting higher exposure to COVID-19, and and because of how many essential workers there are, uh, the statistics are showing that even though we didn't think they would be at high risk, um, just because of the numbers, they're ending up getting hospitalized and dying. Or they, another factor, they don't have paid time off. A lot of these essential workers working in grocery stores or doing food deliveries or all these different things, or healthcare workers, right? Nurses, doctors, pharmacists, um, that might not have the PPE, or PPE isn't perfect, right? So we know that uh, just the amount of exposure um, can affect people. Access to transportation, right? So if I have to go to the grocery store, I can just hop in my car, with someone that has to take the bus. That's going to put them at risk. So we can kind of see, again, all these relate to health disparities as well. So we're kind of priming ourselves for that discussion of, the influence of race, income, socioeconomics, all these different factors, age, everything, um, and how that can influence, uh, the impact of a condition like COVID-19, just as an example of health. The ability to exercise, some of you mentioned, right? So if you're, you know, um, can't go to the gym like you're used to, maybe you don't have childcare access, and so that is, that's leading to different health effects, right? So your kids aren't getting educated in school anymore, so maybe they're, uh, also under stress, right? So that can affect health. Or institutionalized folks, whether they're in a nursing home or, whether incarcerated or, all different types of settings. We've seen that those have been hotspots for COVID-19. And so different social determinants of health can contribute to institutionalization. Social isolation has been certainly receiving some media attention, and I'm sure you have maybe been feeling socially isolated as well. I know I have missed kind of the face-to-face interaction um, with a variety of people, so that can have an effect on health, right? Um, and discrimination. A lot of you mentioned some of the racial bias against Chinese Americans, Asian Americans, uh, getting blamed, getting harassed, getting assaulted, um, because uh, yes, the virus may have originated in China, but that doesn't mean that's any rationale for um, harassing or being violent towards or otherwise discriminating against persons of Asian descent. The last item was about pharmacists, social determinants of health and COVID-19. So you all had some ideas about the pharmacist role, right? How important the pharmacist was to improving access. Um, maybe that's with prescription delivery, right? Especially for older folks that might not be able to get to the pharmacy now. Maybe they used to take the bus, right? Can we deliver it to them instead? Telehealth, can we communicate to people since they can't come into the pharmacy or they can't come into the clinic? Can we provide care in that way? Again, and a lot of these hopefully are providing necessary care to our vulnerable populations, especially in small towns, was one that a lot of you latched onto, right? That the pharmacists can play that role, right? So maybe they're the only healthcare provider in a small town. People aren't going to their primary care appointment. They're canceling all that elective stuff. So the pharmacist then becomes a point of care. They can call the pharmacist that they maybe know. ask questions. Pharmacist, again, is a lot of you mentioned that educator role. Answer questions, provide trusted information, support health literacy. Right? So all these things are going to be especially valuable for our more vulnerable populations. Pharmacists can serve as a role model, uh, someone in the community voice, right? So if you can help speak out against discrimination if you hear it or see it. Correct misinformation, right? So I know a lot of smaller, kind of local pharmacies are posting quality resources online. So that's a good way that pharmacists uh, can kind of support patients in a time like this, especially patients that might need uh, some assistance because they maybe have less education or they have less health literacy. So the pharmacist can be that kind of that trusted resource. Lastly, financial, so prescription assistance. So maybe you can help with some prescription assistance programs for folks that maybe have lost a job or are otherwise suffering because of lost income. Maybe medications can be switched to something lower cost. That's something that pharmacists have been doing for as long as I've been studying them. Lastly, some of you mentioned some things that weren't necessarily related to social determinants of health, but although they kind of could be, but certainly pharmacists, they're primed for a role in point of care testing. When those get online, vaccination, one could think that when we get that COVID-19 vaccine, that the pharmacist could be an important source for providing those. Again, a source for information, source for supply, making hand sanitizer, all these things. Important contributions, and I'm sure there's others, and maybe you can think of them and uh, maybe share it in a comment. So yeah. So just to summarize, we've seen a lot of different social determinants of health here that pharmacists have been responding to and are especially relevant in COVID-19. Kind of the people living in rural areas, not having education, being discriminated against. These are a lot of great examples of social determinants of health. And hopefully we've kind of cemented the importance of these as they relate to health through COVID-19 as an example. So with that, I'll end this session. I encourage you to everyone stay safe, be well, and let me know what questions you have. All right, thanks.